It's just the high score is so tough. That is that a draining tunnel? Is that an abscess? Is that a inflammatory nodule? Is that a
Yes.
non-draining tunnel? I don't know. If I press over here, I think there might be some drainage. Does that mean it's draining? It's just tough.
Oh, and each trial, like it's one of the only diseases that like I actually like carefully watch the video
Yeah.
of like the how you're going to do the assessments because some of them, well, if it's a plaque, you
Yeah.
count it as this, and it's and you
Yeah.
you push 1 centimeter, and I'm like, well, that's not what I'm doing for the other
Yeah.
3 HS trials. Like, what am I going to
I
like?
agree.
Yes, it's
Yeah.
it is incredibly hard disease. The first HS trial I ever did, I then didn't do any for like 2 or 3 years because the drug didn't work and the assessments were awful. Uh, but now that we've got drugs that actually work, I was like, these people need help. And if people are coming to me say, hey, we've got trials with new drugs, like the patients that are getting into the trials are really,
Yeah.
it's making a huge difference for them.
I completely agree, but I do think for the people listening, just knowing how difficult it is to assess HS severity as part of the trials as an investigator, I would really look at pain
Yeah.
reduction as an endpoint. I know that's not the primary endpoint in the trials, but pain reduction and patient satisfaction is such a huge component of the efficacy and success of these drugs. Look at that data. That would be my recommendation because
Yeah.
that's a way that you can truly compare kind of between trials in terms of what the pain reduction is for these poor patients. And that's what's most meaningful, I think.
No, I agree completely. I think the pain reduction is number one for them. Number two is the drainage.
Yeah.
Uh
Oh,
is
yeah.
get those are but pain is not right. If I think if we said to these people, because I always think that way about like in psoriasis, if you said I can get your rash better or your itch better, they would all take the rash.
Mm-hmm.
In AD, if you said I get your rash better or your itch better, they would all take the itch.
Yeah.
HS said I get your pain better or your drainage better. I think the 90% of them would take the pain,
Yeah.
and 10% of them would take the drainage. Like,
That's a
because
good point.
it's just such an awful.
It's horrible.
I feel so bad for people who have that. Well, it's tough.
I say the same thing to my coordinators every time I see one of our poor Hurley 3 patients. It's
Oh,
just be thankful you don't have that.
yeah.
But there's another drug I want to talk about. That's sonelokimab by Moonlake.
That's the new IL-36, right?
This is 17A and F
Oh,
nanobody, so it's inhibitor
yep.
nanobody. Yeah.
Okay.
So this has gone through phase 2, high score 50 of 52%, which is pretty darn good. And then for phase 3, their primary endpoint is high score 75.
Okay.
They're
And
raising the bar.
that's right. And I have great because this is the one, the nanobody idea again,
Yeah.
penetration
Yep.
into the tissue better.
Yeah.
Yeah, that's for the Moonlake, and that's right. They bought somebody that could the name change. Yes, it's gonna be like it's. I wonder because it's interesting to me that Bimzelx is like spectacular in psoriasis, right? Like
Mhm.
it's like Cosentyx and Taltz are really effective drugs to start with, but like it is meaningfully better
Yeah.
than either of those.
Yeah.
I am not like it's not as it's not as big of a jump from Cosentyx to Bimzelx in HS, and that has made me wonder like is IL-17 like not the
Mm.
answer?
Mm.
Right? Which if it's not, if it's just that IL-17 is part of the disease, but not like, then more, better penetration may or may not matter.
Yeah.
Right? It's going to be fascinating to see whether it will or not.